What is going on, everybody? Dr. Thompson here with Exemplify Health Center, your Wellness Way affiliate right here in Yorkville, Illinois. Happy Monday evening. Just finishing up with patients. And I wanted to jump on as promised and talk to you about how reflux medications, how it devastates your body, all right? Guys, make sure that you watch this, and if you know anyone, this might be you, this might be someone that you know and that you love, is taking any kind of reflux medication, do me a favor, please share this with them, tag them in the comments below, please help them. And I want you to make sure that you watch this, but also make sure that they watch this. So make sure that you share this or tag someone specifically who is on reflux medication. It will literally save their life, all right? So, I appreciate all of you guys joining on. Gosh, a lot of people are joining right now. We'll wait. I know it takes about 2 or 3 minutes for Facebook's algorithm to go ahead and notify everybody that we are going live. So I appreciate all of you guys that are jumping on. So reflux medication. Before I do that, I want you guys to know something is I don't spend all day in consultations. So I don't spend 8 hours a day just seeing all these people. About half the day is actually adjusting people. So I am a chiropractor by trade, and half the day is spent taking a lot of physical stressors off of the body. And I will say this, I have seen people literally by just taking one stress off, that being physical stressors off of the spine and then consequently really off of the nerve system, I've seen reflux improve. I'll show you actually why that is. But before we do that, I do spend a lot of times, seeing patients from a chiropractic aspect. And this is really awesome. I've been doing it for, almost 17 years, if you can believe that. I've adjusted well over 200,000 people, or 200,000 adjustments. It does take a little bit of a toll on your body. But it's so awesome is we had a young girl. She has been suffering with lower back pain and sciatica for 9 years, even going to see other chiropractors, and she's about 3 weeks into care. She says, this is the first time in 9 years where I literally don't feel like someone is stabbing me in my back and in my butt, and also had terrible headaches, things like that. Headaches are gone, lower back pain is gone. We had another person who literally came in with a dead arm, like literally their arm was like unusable, it was swollen, it was cold to the touch, had a terrible disc herniation 6 weeks later. Full use of her arm again. They wanted to do a disectomy on her and a fusion on her neck. So we saved her from that $40,000 surgery. Another guy said, a young guy, was never supposed to deadlift again because his back pain was so bad. Doctor said, don't pick up anything off of the floor. He thought, I'll never be able to do that my whole life. He has been deadlifting now for about 8 weeks, just set a 55-pound personal record. And my last appointment was actually a consultation, an awesome guy. When he came in, he said, I want to be able to just walk a mile. He's actually running 3 miles now. He's lost 50 pounds off of cholesterol meds. And this is even before we've actually gotten him to detox. So if you can imagine that. So he's going to be going back to his doctor. They want to actually test his cholesterol levels again. I'm like, you really don't need to. And he said, I just want to because I just want to put my finger in their face and let them know that they were leading me down a very bad path. So these are just some of the things I get to see every single day. That's why I love what I do. I love people who follow through. We love everyone, but we love the people most that are just coachable and willing to follow through with what they need to do. So guys, thank you for joining. Again, tag someone who you know is on reflux medications, because I'm going to show you, and not only am I going to tell you that they devastate the body, because you guys have probably already seen that, all the side effects of taking some kind of PPI or some kind of proton pump inhibitor, or you would know it as some kind of acid reflux type medication. Make sure that you tag them, because I'm going to actually show you the physiology as far as why they cause some of these things that are actually going on. So let's talk about how these reflux medications devastate your body. A lot of times people think, it's just a little reflux, not a big deal. I'll fix it with my Nexium, with my Prevacid, with my Prilosec. And then, yeah, my reflux is going to go away. And doctors tell me it's because I produce too much stomach acid. I'm going to show you why that's not true. And I'm going to show you, though, why all these different things happen. But I'm going to show you what is the answer to being able to go off of acid reflux medication and then allow for just normal digestion to take place. And guys, we do this all of the time. It happens like clockwork because we understand physiology, we understand biochemistry, and we understand what makes a person sick, and most importantly, what is going to help a person get well. So let's talk about this. Now, guys, if you enjoy this, you're going to enjoy the cholesterol webinar that's coming up tomorrow at 8 o'clock p.m. If you go to the top of our Exemplify Health Center Facebook page, you'll be able to register for our cholesterol, medicine's biggest scapegoat. So why medicine blames everything on cholesterol for heart attacks. I'm going to show you from a biochemical, from a physiological standpoint, why cholesterol doesn't cause heart attacks. But I'm also going to show you why you need cholesterol as far as hormones, brain function, and things like that. It's going to blow you out of the water. I know we did it on Saturday, and we had a lot of people who joined us for that. Thank you if you were on. But we're also going to be doing it again on Tuesday, 8 o'clock at night. You can go ahead and go to the top of our page as a pin post, and you will get the links to be able to register for that webinar. It's completely free. It is awesome. Guys, expand your knowledge, expand your learning. The reason why we teach so much here in this office is because we want to educate our patients so that they can become an advocate, so they can teach other people, because I can't reach everyone, but you can if we do this together. So if you haven't registered for that, make sure that you register for the cholesterol event. Let's get into the bread and butter of what I'm going to talk about tonight. Guys, give me a thumbs up if you are ready to learn how reflux medications devastate your body, how they devastate your body. Now, by now, you probably have seen all of the different types of reports about why reflux medication devastates the body, why it is so bad for you. But I'm actually going to give you an aha moment and show you biochemically why they cause so many issues inside the body. So let's go over. These are just some of the side effects, not all of them. So you guys probably heard about this back in 2010 when they said, uh-oh, wait a second, we are increasing fractures in people. We're actually giving them osteoporosis. So they saw even just taking a PPI or I'll call it a reflux medication, but from now on I'm going to call it a PPI because it's just simpler to say, proton pump inhibitor. They said someone who takes it for 2 years, they significantly increase their risk of having a hip fracture. And guys, I want you to know something. People don't fall and break their hip. They break their hip and then they fall. So there's literally a collapse, just a sudden fracture because it's been weakened for so long. And just a sudden movement or just standing on it is the straw that breaks the camel's back. I'm going to talk about why it causes an increased risk for fractures. This is not only just in the hip, but this is also anything that bears weight, which can also be in the spine, and it can also be in the neck of the humerus with any kind of load bearing, especially overhead. Second side effect is pneumonia. I'm going to show you why it causes pneumonia. Thirdly, I'm going to talk to you about why it causes irritable bowel and also infection in the large intestine. Okay, so infection in the intestines. If you guys ever heard of C. diff, people are like, I got a C. diff infection. I'm like, so it's not that necessarily that big a deal, and I'll show you why. Why it can actually cause cardiac arrhythmia, and I'm also going to show you why it is linked to dementia. Guys, this is really, really important. Why it's linked to dementia, and I'm going to show you why it is. A couple of years ago, they actually said, yep, we're noticing PPIs and an increased significant, not just a little bit of an increased risk, but a significant increased risk of dementia. But we don't know why, and now we actually know. That was from a journal, like the Journal of Alzheimer's, back in July of 2020. So let's talk about this. But before we actually talk about all these different side effects, let's talk about just some basic stomach physiology, okay? So what you see on there is you see a really big word. It's called hypochlorhydria, okay? Hypochlorhydria. Doctors love using big Latin words because it scares you. And so you think about, I have hypochlorhydria. And so a lot of times we carry around that fancy name as a badge. It's no different than like today. When people are like, I have COVID. And I asked somebody today, I'm like, if there was no such thing as COVID and you got sick with the same symptoms of COVID, what would you think it was? And they're like, a flu? And I'm like, bingo. But now you actually make COVID sound nasty, sound terrible. You give it a persona like it's going around attacking people, and it's got a brain because it knows when to attack, when not to attack, because obviously, if you're sitting down in a restaurant, it's not going to attack, but as soon as you stand up, it knows that you're supposed to attack. And so we give it a fancy word, and it scares people. So hypochlorhydriol, all it is a fancy word for having low stomach acid. You don't have enough stomach acid, and not having enough stomach acid is the start of a lot of problems that take place inside the body. Let's go over why two things can happen. Number one, you can have acid reflux, gastroesophageal reflux disease, or why you can actually develop an ulcer. Okay, so here's what happens. If you look at the stomach, this is where food comes down first. So it goes through the esophagus. You got a sphincter that's right there. You also have a sphincter that opens and closes. So when you eat, the sphincter opens up, food goes down, it goes into the stomach, and stomach acid is released by these different types of parietal cells in the stomach, and they release acid, okay? Here's what this acid is actually supposed to do. If you look at what the true function of the stomach is, it's really just to do two things. The first thing is that in a high acid environment in the stomach, it's really designed first and foremost to sterilize your food. Pay attention to that, to sterilize your food. Because when you eat food and the food is actually tainted with bacteria, things like that, then if it's not sterilized, you're going to have a lot higher risk of having food poisoning. Think about that. Why can two people eat the same food, one gets food poisoning, the other doesn't? It's because that person is actually making sufficient stomach acid to sterilize the food properly. So the first thing is you got to sterilize the food. The second thing that it has to do is to break down your proteins. See, proteins are the hardest thing to break down. Proteins, really, the protein digestion actually takes place in the stomach, and it can take a while for those proteins to be able to get broke down, and get broke down into amino acids by having sufficient stomach acid, okay? Now here is the problem. Let's talk about reflux. If you do not make enough stomach acid, then what happens is that food comes in, it starts to get mixed around by the stomach, and it starts to make its way down to what's known as the pyloric sphincter. There's a little sensor on that sphincter that says, has this food been properly mixed and broken down? So has it been sufficiently broken down by the time that it gets to this point? And if this does not have a proper pH, so if there's not a low enough pH, meaning this is not acidic enough, then one of the things that'll happen is that it will send this food back up into the stomach to get mixed again until there is sufficient acidity to that. Because again, the primary responsibility of that stomach is to actually sterilize the food. Well, when this thing closes back up, this sphincter up there is actually still open. So if it then propulses this food, because remember the stomach is a muscle, if it propulses this food and this sphincter is open, then you have a very high amount of acid that starts to irritate the tissue up here, because this tissue is not protected like the stomach to be able to sustain a very high acid environment. So if you get that acid to go up into the esophagus, that's where you get the burning, that's where you get the pain, that's where you get the chest tightening, and that's what will start to erode this esophageal lining, and that's what actually can lead long-term to esophageal cancer. They call it, like before that happens, Barrett's esophagus, okay? So think of this. That's what happens if you don't make enough stomach acid. Well, Dr. Nate, I have actually an ulcer, okay? Why do I have an ulcer in my stomach? It's obviously because I got too much acid. It's burning away, okay? It's burning away my stomach lining. That doesn't happen either. If you actually look at having an ulcer, it's actually caused by an H. pylori bacterial infection, and here's how you get it. Remember, guys, an infection is really opportunistic. You don't catch it. It's something that grows, that overgrows, that's already been there. So you do have H. pylori that actually sits out right next to this sphincter, and it can hang out there because the environment is not as acidic from here versus within the stomach. So if you're chronically low stomach acid, then one of the things that you'll actually will see is that that bacteria then can start to migrate into the stomach because it's a perfect environment, low stomach acid. And then what happens is that you'll develop an infection that starts to eat away at the lining of the stomach. So then anytime that happens, you do eat, and even if you release a little bit of stomach acid, it's like pouring like acid on a blister. I mean, it hurts. And so that's why it can hurt so much when you have some kind of ulcer. How you handle it is actually, something separate. It's different. It's a different animal than actually just treating gastroesophageal reflux disease, or GERD, or acid reflux. But if you have sufficient stomach acid, then what happens is this gets mixed, and then it passes down into the small intestine, and food is then continued to get digested by the pancreas, by the gallbladder, and things like that. So that's how the stomach works. So if you look at hypochlorhydria, low stomach acid, the answer is that you need sufficient stomach acid. But let's talk about the physiology as far as why some of these side effects occur when it comes to any kind of PPIs, proton pump inhibitors. So again, I went over the side effects, but let's talk about this right here. Let's talk about fracture risk. Why do you have an increase of fracture risk? And it's not just a little bit of a fracture risk, it's a significant risk for having some kind of fracture. So it's usually the hip, usually the neck of the humerus, or it's actually in the spine, some kind of compression fracture. The thing is when you take a proton pump inhibitor, what it does is that it basically lowers the stomach acid inside of the body. So it inhibits the release of stomach acid, hydrochloric acid, within the stomach. Now, I want you to think about this. In order for you to be able to absorb calcium, you actually need high amounts of stomach acid. So in the small intestine, when you are absorbing calcium, you need a high acidic type environment. And so if you are not absorbing calcium, you don't have something that's foundational for those bones to be able to continue to get broken down and remodeled according to lines of stress. So yes, exercise is important. Yes, doing those things are important, but if you're not even getting the basic building blocks, you cannot make something from nothing. So if you got low stomach acid, you're not going to be able to absorb calcium the way that you're supposed to, and this is why they have an increase in fracture risk. And they said it really only took about 2 years. And remember, PPIs were actually supposed to be used very short term, but there's people that are using them for 1 year, 2 years, my goodness, 10 years, 15 years. We have a woman we just saw was taking it for 25 years, and I shudder to think what is actually happening inside of her body. Now, interestingly enough, what do you also need in order to have a high acid environment to be able to absorb other things? Magnesium. You need iron to be able to absorb iron. Vitamin B12, and then so think about all the other issues you can have if you have a B vitamin deficiency, low iron like anemia, or not even having enough magnesium. You don't have enough magnesium, think about having chronic muscle cramping, heart arrhythmias, things like that. So fracture risk is at the top of the list. Now, how on earth can you get pneumonia as a side effect of taking a PPI? Well, I want you to think of this. Remember, the primary reason why you have stomach acid is to actually start to sterilize your food. So if you chronically have low stomach acid and then you're lowering it even more by taking a PPI, you're never going to sterilize your food the way that you're supposed to. So I want you to think of this. If you have reflux, you can actually have something in the stomach. It doesn't get properly mixed, doesn't get properly broken down, doesn't get properly sterilized. You can actually reflux that back up through the esophagus, and you could even swallow that or have it go down into the lungs, and then what happens is you can develop an infection in the lungs. So just think, not sterilizing your food, it comes back up, now it actually goes down into the lungs, and now it can develop an infection like pneumonia, okay? So that's how it can affect pneumonia. Let's talk about irritable bowel or even C. diff, okay? So how on earth can taking a PPI cause an infection? Well, I want you to think of this, is that remember, stomach acid is king. That if you are having proper stomach acid, and that stomach acid is traveling its way down the small intestine, eventually into the large intestine, then what happens is if you're not producing enough stomach acid, a lot of the normal bacteria that live in the large intestine can actually start to creep up into the small intestine because it's a perfect environment for it. So when people say, yeah, I have a SIBO or small intestinal bacterial overgrowth, or yeah, I got a C. diff, because remember, very easy to get a C. diff infection in a hospital. And so again, low stomach acid, and it just becomes a perfect environment for an overgrowth of specific bacteria. That's why when we do stool tests and we see that, they have all of this extra bacteria that are actually growing within the small intestine, we're not trying to actually kill it. We just realize that their stomach has been producing such low acid for such a long time that just normal bacteria can start to overgrow because it's now a perfect environment. Let's talk about how you can develop a cardiac arrhythmia. Guys, do you know how many patients they go and they have developed some kind of abnormal cardiac arrhythmia? And they're like, well, we got to go ahead and we got to do a cardiac ablation. We got to burn part of the heart away. Or, or you need to be on, some kind of blood thinner because you're going to have an increased risk of, having some kind of stroke or some kind of blood clot. So guys, cardiac arrhythmia, how on earth can this actually happen? I've had people, in fact, we just had a patient who, he just got a new EKG, and for the first time in 2 years, he had a normal one. And again, no medication, nothing. We just understood what physiology is and how to get the heart to start beating normally. But how can taking a PPI lead to having a cardiac arrhythmia, okay? Now, this actually you have to go back to neurology a little bit, because if you look at this right here, remember, all of your organs are innervated by nerves. So you have your sympathetic nerve system, you have your parasympathetic nerve system. One is a fight or flight response, the other one is a rest and digest, okay? Now, that rest and digest response primarily is responsible for a really important nerve that comes out from the brainstem and wanders all across all of the organs, including the stomach and also including the heart. It's called the vagus nerve, okay? The vagus nerve, look it up. Well, the vagus nerve, again, nerves run on neurotransmitters. Neurotransmitters, it's how they communicate. And the neurotransmitter, especially when it comes to the vagus nerve, is predominantly known as acetylcholine. So it's known as acetylcholine. So that vagus nerve is responsible for actually being the pacemaker of the heart. They go in and they give an artificial pacemaker. I'm like, there's nothing wrong with the nerve. You got to start looking deeper. So it acts as the pacemaker, okay? It also acts as that vagus nerve also acts to expand and contract your arteries, especially to expand the arteries and to allow more blood to be able to pass through. Another thing, the neurotransmitter that does this is acetylcholine. So acetylcholine is one of the most predominant neurotransmitters within the nerve system, okay? Now, PPIs, the reason why they can cause a heart arrhythmia is because these PPIs actually block the enzyme in order to make acetylcholine. So it blocks the enzyme so that now you cannot make acetylcholine. Then how on earth is the nerve system supposed to regulate and be the pacemaker for the heart? That's how it can cause a cardiac arrhythmia. Now let's talk about dementia. Guys, this is going to blow you out of the water, guys. How do you know dementia is absolutely exploding? Drive down the street and you will see memory care facilities popping up like you would not believe. So dementia, Alzheimer's, things like that is absolutely exploding. But you think about it, the biggest things with Alzheimer's or with dementia, especially where you need to look, is you got to see, is there any kind of side effects that are taken from medication? Because again, cholesterol medication will cause dementia. It's a side effect. PPIs will actually cause dementia. But then also, is this person extremely insulin resistant or type 2 diabetic? Because they call that now type 3 diabetes, which means that the brain now becomes insulin resistant, okay? So how on earth can this cause dementia with PPIs? So I want you to think of this. Again, one of the most abundant neurotransmitters is acetylcholine, okay? And remember, PPIs, what they do is they inhibit the enzyme that's needed to make and be able to produce acetylcholine within the neuron, which means you take a PPI, you're going to drastically over time reduce this acetylcholine. But I want you to think, what on earth, how does the brain run in certain parts of the brain? like in the hippocampus where memories is stored, like in the gray matter on the surface of the brain where actually you are coming up with thought, things like that. So think of thought and think of memory. Those areas in the gray matter of the hippocampus, those areas are highly dependent on acetylcholine. So PPIs will then inhibit it. So then how on earth are you able to form memories? How on earth are you able to recall memories? How on earth are you able to come up with any kind of thought pattern or any kind of communication pattern if you do not have the very thing that's needed for your nerves to be able to communicate with one another? Which is why when I see people who have that, I'm looking and scouring over their history saying, have they been on a PPI? Are they on a cholesterol medication? Are they insulin resistant? And what can we do to try to do as much as possible to help them come out of it? But we don't know how much permanent brain damage has actually been there. So fracture risk, pneumonia, irritable bowel, C. diff, cardiac arrhythmia, dementia. I hope, guys, that when you talk about this, this is now why these PPIs cause so many types of issues. And guys, this is not my opinion. This actually comes out of PubMed. If you want to look at it, you can look it up. Yes, you can Google it because literally the archives, National Library of Medicine is on Google. And so if you go to pubmed.gov and I type this in, here's what they say. Proton pump inhibitors act with unprecedented potencies as inhibitors of the acetylcholine biosynthesizing enzyme A. It's the plausible missing link for their association with the incidence of dementia. And this came out July of 2020. See, for the longest time, they thought, well, we know that there's a significant increased risk of dementia. We have no idea why. Now they know exactly why, because it interferes with communication of the nerves. And again, nerves communicate via neurotransmitters, and PPIs will devastate it. So guys, hopefully that makes a lot of sense. So what is the solution? Guys, with everyone, we're trying to see, is this person actually making enough stomach acid? Well, Dr. Nate, how can you not make enough stomach acid? Well, again, what it comes down to is stressors and inflammation. So mental stress, guys, if you have mental stress, guess what? The digestive system shuts down. If you have mental stress, you will not make enough stomach acid, meaning you will not be sterilizing your food, you will not be breaking down your proteins the way that you are supposed to. Now, you get away with it for a while, but over time you'll notice that you will start developing reflux. So mental stress can do it. Chemical stressors can do it. Think of food allergies. Guys, we have had people be able to get off of the reflux medication within a couple of weeks if you know what you're doing. And then the last thing is physical stressors, physical inflammation. So guys, if you have a lot of inflammation that's taking around the spine and around the nerve system, because remember, the body communicates via hormones and it communicates via nerves. Nerves are quick, hormones are slow. Nerves will happen right away to help you adapt immediately to your environment. Hormones, what they'll do is they help you adapt long-term to your environment. And that's why you have to start addressing all three: mental, chemical, and physical stressors. And if you do that, some people have all three, some people have two, some people just have one, which is why even just by addressing physical stressors, you will see digestion start to improve. Better bowel movements, not having any kind of reflux and things like that. Some people, it's more of a chemical issue. Some people, it's just purely mental stress. And I will tell you something, is that during COVID-19, during the pandemic, whatever you want to call it, is I had a lot of stress and I started to develop for the first time in my life reflux. So what do you think I had to do? I had to start addressing some of these stressors, but I actually started to add more stomach acid in. You might say, hey, what on earth, how do you add more stomach acid? You make the stomach more acid. This is why things like apple cider vinegar can help for some people, but some people, they need a lot stronger acid like betaine hydrochloric acid. It just depends on how bad the actual reflux is. So this is one of the reasons why I love apple cider vinegar, because it can actually start adding acid in the stomach to help you sterilize and break down your food a little bit better. Now, when it comes to having an ulcer, I got to approach that a little bit differently. I can go over that in another live possibly. All right. So guys, I want you guys to understand something, okay? Because some of you may be like, yeah, but like my cousins, my second cousin's boyfriend, great grandma, she was on a reflux medication. She did fine. She lived until she was 90. Well, guys, I want you guys to know something, is that it all works together. It all works together. So just because someone doesn't have some kind of side effect doesn't mean that it's not happening. Because many times doctors aren't even checking the right labs to see if this could be developing inside of the body. Like a lot of times when we talk about the labs that we run with type 2 diabetes, and the doctors tell them that they're fine, and they're actually pre-diabetic and they have no idea. So you look at the Swiss watch principle, guys, on how everything actually works together. Guys, if you have a problem with your digestive system, I just showed you how it affects the nerve system. I actually just showed you how it can affect the immune system, how it can affect the endocrine system, how it affects the circulatory system, and we talked about one thing, the digestive system, and not having enough stomach acid. Do you guys see how wonderful, how intricate the body is? We have to stop looking at the body as this for that. This is why my pet peeve is when people say, I have this, what should I take for it? When you don't understand how everything actually works together and what it takes to actually start rebuilding the body like a carpenter versus just trying to put out fires all of the time. Let me ask you a question. Are you tired of being manipulated? Because that's what happens with medicine, and thank God they can save people's lives, but they manipulate and they do this for that with devastating side effects that happen in other parts of the body. Guys, what would happen if someone that you loved were on a proton pump inhibitor, they started to have all of these other symptoms that are going on. They started to have osteoporosis. So then they put them on an osteoporosis medication. Then they start having some problems with memory. And then they put them on some kind of memory type of drug. They start to have a heart arrhythmias. Then they put them on blood thinners. And then they put them on, do some kind of cardiac ablation. Or they get some kind of infection in their intestines. They put them on an antibiotic. Do you see literally the rabbit hole that people go down, and then they come here as a last resort, and then they're saying, please fix me in 1 week. I'll give you a week. So you see, guys, we have been abusing our bodies for so long, and it's time to stop. It's time to start restoring the body and to stop trying to manipulate it, because the body is beautiful and it is wonderful. It's beautifully made. You guys need to start honoring it with your lifestyle. So hopefully, guys, that made a lot of sense to you. Hopefully you now can see PPIs and see it from a different perspective. And guys, if you want to see a different perspective, join me tomorrow, 8 o'clock, for our webinar on cholesterol, medicine's biggest scapegoat. Guys, if you talk about cholesterol, if you were blown away by this, I will also promise you, I will blow you away about cholesterol and why you actually need it, why older people actually need their cholesterol to go up. And literally, if you artificially start lowering cholesterol, how it, yes, can cause dementia, how it doesn't prevent heart attacks whatsoever. Who says so? They do. And also how it will devastate your hormone response, because cholesterol is the backbone of all of your hormones. So hopefully, guys, that makes a lot of sense. You can register for this webinar at the top of our page. If you go to the top of our page, you see a pin post. It's got the link that you can register for tomorrow, Tuesday, October 978th, it feels like, at 8 o'clock for that event. So guys, I got to run. I appreciate all of you guys being on. Allie, how are you doing? How are you doing? Heidi, Carrie, thank you for the wonderful comments. Katie, Jackie, Sue, Barb, Emily, Suzanne, Katie, a lot of people on. I cannot know Kajta, I want to say, Christine, Summer, Tahila, thank you. Vicky, Lisa, I'm probably leaving some people out. Heather, Sandra, thank you guys so much. Diane. And guys, if this made sense to you, make sure that you tag someone who's taken a reflux medication and say, hey, can you take just 20, 30 minutes and look over this, because what I have to go over with you can save your life. So guys, have an awesome Monday night. Hope you guys have a great evening, and we will see you soon.